Hi, it's Amber again. I wanted to share this next part of the story, which was our visit to the OBGYN and us asking all the questions we had and kind of what the next steps were. So, in meeting with the OBGYN, she wasn't able to answer 100% of the questions or predict outcomes. But it was very helpful to talk to her. And she did share that she had 5 to 6 other patients that were in my age range, in the older age range. And that was a little reassuring to know that she had some experience with that. The higher risk issues or concerns were Down syndrome, having an increase of preeclampsia, possibly, but again, that can affect women at any age. Early miscarriage in the first trimester was an increased rate for that. 40% chance of having a miscarriage in the first trimester for women in their 40s, whereas women in their 20s only have a 15% chance of a miscarriage in the first trimester. So I think that was a huge concern, as well as knowing that I would have a healthy baby. I wanted to ensure that in some way. And I knew there was maybe not 100% chance, but I wanted to do all the testing that I could to mitigate any health issues. And the reason is because I had taken care of a very close family member for about 15 years because of a progressive disease that they had, and navigating the whole system, the medical system, and just watching that progression was extremely traumatic and difficult. And I didn't want to go through that. And I just didn't think it was fair to do that, to go through that situation. And that's just me personally being concerned about that and why I was concerned. And so we did do a lot of testing. I felt like I was in good overall healthy condition. I was a healthy person, so I felt like I could carry the pregnancy through. I still was aware that I needed some additional testing to check on the health of the baby. And in addition, we were referred to a specialist because of anybody that's high risk, regardless of what that high risk is. Sometimes it's age, sometimes if you're diabetic, whatever, that you will be referred to a specialist, at least in the state that we're in. So we were referred to a specialist, and those, as we did decide to move forward with the pregnancy. And we did start seeing the specialist like maybe once every 2 weeks, and then it slowly increased as the pregnancy continued. And there was some reasons why, and I can go into some more details on that as well in another video. But it was a very long process. And, the next part is really sharing the information with family as well. So making that decision, sharing it with family, but knowing that we were still getting testing done. And if there was a test that came back that was, ringing alarms that something was not okay, we were trying to be careful of how many people we told. So that was very tricky. And then getting later in the pregnancy, as we were able to move forward, letting people know at work and everybody having their ideas on my part, especially as a woman, of like, how old are you? And how, and for a lot of people, that's none of their business. I mean, honestly, and I don't have that type of relationship that they should care so much about that. But I was really, that was another piece of it that I think women that are older may consider as it's a challenge, another challenge I think that women that are later in life face, is like just judgment of some kind. And so I had to navigate that, and that was at my point in life too, to an extent. I don't really care what other people think so much, But that was just another piece that is a part of the equation when you're looking at having a baby older in life. So there's more I'd like to share with you. I'm trying to keep these videos pretty short because of my limited time, and I'm sure I feel like other women have limited time. I hope these are helpful. That is my intention for these. And if there's anything that you would like me to share or go into detail about or have more questions, please just message me. And thanks again for watching. Bye.